Welcome to my educative channel. I'm Dr. Ricardo Giustra, plastic surgeon, Buenos Aires, Argentina. I specialize in minimal invasive facial rejuvenation. We have many young patients with fatty neck without definition of the mandibular branch and with a bulky area here with a deep sulcus. If the patient do not want a surgery, the idea will be a liposuction, a facelift, but to avoid this kind of invasive procedure, I perform ultrasound. With ultrasound, I smell the fat in this area and I make this area even. This is very important because this is a long-lasting result, and this patient needs very little fillers in this area. Avoid a lot of time to go into plastic surgeon, avoid a lot of spending money for fillers. But also this patient has a square face and here has an oval face. You can see a complete lack of the definition of the mandibular branch and all this fatty neck and this protruding nasolabial sulcus. And this is with 3 hours of ultrasound. You're going to hear a lot of ultrasound. The cosmetologists have ultrasound, many medical doctors have ultrasound, but the results are very little. I developed a special machine that my team and I can have this kind of result. Take us nearly 4 hours in our clinic. The patient can have a breakfast, have a lunch. We spend nearly 6 hours with the patient. Generally also we make fillers in the chin and a little in the nasolabial sulcus. Here you can see the immediate result. This patient comes from outside of the country. You can see the bulk here. Just see, you trace a line here and you can see. And also I put a little of hyaluronic acid in the chin. And this patient is going to have a long-lasting result. It's going to improve because the collagen are tightening. Another patient from the south, comes from Indonesia. Patient from Switzerland. You can see the definition of the mandibular branch and the improvement of the neck. This patient have little fat here, but this improved a lot. This patient have long-lasting result and they avoid a facial surgery for many years because it's not only melting the fat like a liposuction, but also tightening the collagen. The definition plus fillers. Another patient. They stay in my clinic several hours. Some of the patients stay 8 hours. We perform the treatment, they stop. This is result we get immediately, have no downtime, have no complication, is not painful because we perform like a massage here. Many of them have with fillers in the chin and fillers here. You can see the definition. You can can see the definition of the mandibular branch. No fillers. You trace a line from here, from the chin to there, and the chin to here. You can be an acute angle, and here you can see how open the angle. The definition of the mandibular branch, not fillers in the chin. Okay, this is what I'm doing. The patients are very happy with the result. I have an immediate result. This technique acts in two different ways. The best result, we have a patient with a fatty neck in this area, because the machine working with melting the fat like a laser. Have no anesthesia, no downtime. But in the other way, that is collagen stimulation. That is going to improve during the months, almost 6 months. Many patients said, when are you going to repeat this treatment? I think it's better to perform once in a year. Also to associate with microneedles once in a year. In this way, they are going to tighten the skin and avoid facial surgery for many years. I hope you enjoyed this presentation. We wait for you in Buenos Aires, Argentina. You can do this one day and you can traveling around my country and enjoy it.